PinPoint Health Show. We're back on the air here. PinPointHealth.ca 1-855-55 Dr. Lou DRLOU to reach out. Same goes for social as well. If you're on Instagram or Facebook, a real presence building there, pal. You got some good stuff, including videos and I won't say how-to stuff, but it's great knowledge for people to have moving forward. So I know you're always building on that. What's going on, pal?
Not too much. The social thing is the biggest thing about it is supposed to be the visual component. Yep. So we obviously have the audio that happens here, but there are a lot of things when we're talking about this stuff that we can't really relay properly over the airwaves. And so the best way is follow us on Instagram or Facebook, or as John says, Insta. But check PinPoint Health, Dr. Lou, all of those things. You can follow my personal page, and all of those things are intertwined. And again, there'll be snippets of the show with little things that are sort of highlights from the show, but as well the visual component of any exercises or visual descriptions that we might need to go through. So some very interesting stuff. I'm really happy with it. And, PinPoint Health as well. That's right. The new brand that we are going. This is the PinPoint Health Show now. And again, nothing changes in terms of the quality of service, the people that we have. It was really just a matter of a standardized brand, so that there's an accountability factor, so that people have a safe place that they can go, that they know is affiliated with me in the radio show, which provides, I think, a tremendous amount of accountability. I've said this, hundreds of times on the show. We've gotten calls about the compliments, and I love hearing those, and I'm very happy that people are happy. But equally so, I want to hear if there's ever any concerns that people have had, either with me, myself, with my assessments, or with anybody in my team. We really strive to make it's healthcare, right? So part of healthcare is also the psychosocial, which is what we talk about. Yep. So, I mean, if you're going somewhere and you feel stressed about the interactions, anything about it, well, then that's not true health, right? So our whole goal here is to make this as stress-free as possible. We want to make sure that you're getting the care that you need. And more than just those things, the stress of it, we want to make sure that you understand what is happening, that you are informed from start to end, that you understand why certain questions are being asked, all the way to why a certain test would be ordered. What are we thinking when we're going through the differential diagnosis and the diagnosis? We're including you in the plan of management. That's a big thing with plan of management for patients, not just for us, but for any healthcare professional, is also including what the patient wants in that, and what the patient's expectations might be, and what their goals are. Because, of course, we may think that something is the best intervention for a certain injury or a certain pathology, but what if the patient doesn't want to do that, right? You have to be comfortable, and that's very important. And the great thing is we have so many tools at our disposal that if you're not okay with one thing, we have something else that we can likely do. Now, we'll be honest if we don't think it's necessarily going to be as effective for what it is you require. We have different tools for effectiveness, and we really try to tailor our care to what we believe is best, but also what the patient requires.
Well, one of the things you've always done, even before you rebranded and took more control, and even on the phones when we get phone calls here in the show, so many cases we hear of doctors at every level. They see a patient, and maybe it's not a bad thing. They're not doing it with any sort of malice. They'll just say, "Here's what you need. Here's the pill, or here's this," and they just kind of send them off. And the patient's like, how about a little bit more explanation of why I'm doing this? And that builds anxiety, right?
Yeah, and it's a systemic problem within our system, right? Like we do have a system that is very backlogged. I totally agree with you. Right. I don't think there's any malice. I don't think any healthcare professional is out there to do horrible things, right? Everybody gets into some type of a healthcare profession because they want to help people, because they want to do something that can make someone else's life better. But unfortunately, when it comes to backlogs in the system, time management, things like pay as well for doctors, all those things matter. And unfortunately, it does sometimes where the issue is at the end part, at the end user, which is the patient, right? They are the ones that are going to necessarily, it's what you just said is not an atypical type of presentation where someone comes in, doctor does something, doctor then tells patient, here's what you have, here's what you should do, bye. And, if that lasts 5-7 minutes, sometimes that's like even maybe an overestimation.
Right.
But there's no way that in that amount of time you can get all the knowledge that you possibly require about what you have going on. And I think that's something that at PinPoint Health, we're really, really trying to do different. I could tell you that the biggest part of my interaction when I see a patient is spent explaining, and anybody who's ever seen me could testify to that. They could give you that testimonial. That's really what I try to make sure is that people understand from start to finish what's going on. And I get a lot of people that already come in with, they know what's wrong. They know the diagnosis. They have all the documentation to prove the diagnosis, but they turn to me and say, I don't understand it. I've tried to do my own research on Google. I've tried to look things up, but it's just too complicated for me to understand. Can you break it down? And that's exactly what I'll do. I will make sure that I agree with the diagnosis, obviously, as from a due diligence perspective, but oftentimes I do. And oftentimes it's really about, okay, here's what it is, but also understanding the intrinsics of the diagnosis. So a good example with that is if you understand spinal stenosis and you understand what it is, you don't have to memorize that flexion-based exercises for your low back are good for you. You will inherently understand it. And that's no different than when people go through school. And you always talk about it's better if you understand because you don't need to memorize. Because when you're memorizing, you're able to forget. Whereas when something is ingrained in you, you understand it, it becomes second nature. And that's what we want, is we want people to understand the extent of the things that are going wrong with them and how they can make it better.
Lots still to come here. Stick around. You want to reach out, 1-855-55-Dr. Lou, DRLOU. And then through email is info@pinpointhealth.ca. That's the same for the website. And social media as well. Pinpoint Health Show continues. Global News Radio. Pinpoint Health Show, right back at you. Want to reach out, get a hold of Dr. Lou. It is 1-855-55-DRLOU. That's Dr. Lou, pinpointhealth.ca. You know, we're talking about the emerging social media aspect of Pinpoint Health, which is really cool. We're going to talk about how you have more control over the entire provider network, which is, I know, what you're building on for the last couple of years. But, you know, we kind of left the last segment saying it's nice when your medical team, especially the practitioners that you have working with you, they take the time for the assessment and they actually explain things, which again, I think is a real benefit of some of the video production that you put on Pinpoint Health. Because if you go there and tell someone, okay, if you want a good exercise for you would be to deadlift. So keep your back flat, your wrists supinated, and stand. That means nothing to anybody. No. You and I, it does, because we know the language. Yeah. Because I
but
deadlift.
It's difficult to digest.
But when you
sure.
see it, now absolutely. I get it, right?
Well, and the other thing here, I'm also a teacher. I teach chiropractic students.
Right.
And part of my role as a teacher is we have to go through understanding that some people are visual learners. Some people learn through listening. Some people need to do their own. So there's different ways that people can learn. And really with the radio show, we're targeting one avenue of learning.
Yep.
And so the social media aspect of it, the visual component of it, just gives us another tool for learning so that people can go see these things. And I encourage people, if there's something there that you want to know about and it's not there, just send a message and I'll make a video, or I'll find a video. I'll do the explanations around the things that you're wondering. And we'll try to tie it in with what happens on the show for sure. But you might be at home thinking, well, you know, I'd really love to understand on a visual perspective, what is spinal stenosis?
Yeah, why is riding a bike good for that?
Right, exactly. Yeah. Just let us know that. We will likely do a video or something on that eventually anyways. But if it's something you really want to know, I'm sure there's hundreds of other people that want to know that as well. So I don't have a problem with those suggestions as well to really tailor it to no different than what we do on the show. People call in with what their concerns are, and we tailor the show towards those concerns. Again,
pinpointhealth.ca on social and email as well. info@pinpointhealth.ca, 1-855-55-Dr. Lou. The number's the same to reach out to get hold of Dr. Lou anytime. We haven't talked about for a little while, and I wanted to double back on it, is the PRP for the knees. How's that going so far? I've heard more about it in general media and on the news as well, but you guys have been all over this for some time.
So I think before we jump into the PRP, which I definitely want to tie in with Pinpoint Health, because I want to go back to something you said about the provider network. When we first started doing this, I created a provider network of trusted professionals that when someone came to see me and then had to go out into the community to get some type of care, we had that provider network. That was a great way to start, but really as things progressed and the amount of people that have come to see me, I really wanted to make sure that I also had control over the operations of the clinics. Because again, I don't have, if it went in the provider network, that wasn't something that I could do. But
you trusted them, but
I trusted them, and
when push comes to shove, it's a different clinic.
100%. And it's, you know, there's only so much that I can really do. Now, obviously, if I had ever heard something bad or had found something out, I would eliminate them from my provider network. But it was something that, and a lot of these trusted professionals may have been individual professionals working alone, where the whole thing that I'm always really trying to advocate for is that multidisciplinary approach. And PinPoint Health is a chain of clinics that offer that multidisciplinary care. And we have services all the way from general massage therapy, but that you might use for just simple relaxation and stress relief, to more invasive therapies like chiropractic and physiotherapy when it comes to injury-based, but all the way to surgeons when you require very invasive procedures that might be there, and things like you just brought up, which is the PRP. So the extent of services that's available at PinPoint Health is vast, and it's vast so that the people can get the best care. Now, we'll often get people that call in and say, I need to see a chiropractor. When can I do that?
Sure.
And that's absolutely fine. But I would also encourage people to give me a call, and let's start with what you're feeling first. What are your symptoms? What are the things that are going on? Because, again, it's always about matching up the treatment intervention with the diagnosis. And you may think you know the diagnosis, but you may be wrong.
Yep.
And so I may be wrong too, but this is why we have a team of people, so that if we can figure out, okay, well, this does very much seem like mechanical low back pain, potentially a restricted facet, then yeah, chiropractic maybe is the best option for that. But if it's something else where it's a very, it's a knee issue, it's a torn meniscus, and you thought you needed physiotherapy, but it's so bad that probably surgery is an option, well, wouldn't you want to know that? That doesn't mean you have to follow through with surgery, but at least you're offered the best possible solution. Because the biggest thing here with injury and pain is the early intervention on these things. So the earlier we can intervene with what should be the appropriate measure, the better the success or prognosis for the patient. So if you do require surgery, it is best to do so early and not wait, because then prognosis goes down as things become more and more complicated. So the point that I'm trying to make is the number of services, again, is vast. I encourage people, visit pinpointhealth.ca. There's a section there, services. Read through everything. Take a look. We have dozens and dozens of different services. And the other good thing about that is we don't, I've always said, if you have a hammer, everything becomes a nail.
Right.
We're not offering some device as the solution for everything, or some type of intervention as the solution for everything. No, that's not what the research supports. The research supports evidence-based medicine, that there are better interventions for different things. And really what we're trying to do is identify the issue and provide the best intervention for that problem, and the whole goal is that we have that in one chain of clinics.
Reaching out simple, 1-855-55-Dr. Lou, DRLOU, info@pinpointhealth.ca. Online and social as well, it is pinpointhealth.ca. Want to check it out on Facebook and Instagram as well, and all your social networks. Lots more. The PinPoint Health Show is on the way. Global News Radio. PinPoint Health Show. You want to reach out, 1-855-55-Dr. Lou, DRLOU, info@pinpointhealth.ca. Rebranded and the same great service. How about that?
Speech, that is a clinical sign that we need to worry about there, John.
You're going to diagnose me after the show. Get me up on site. We'll do it on video, okay?
I think you're fine. I'm not a plastic surgeon.
That's right. Facebook and Instagram as well. On social, it is PinPoint Health. And we talked about the fact that it's not just you with a provider network that you trust. Now for lack of a better term, you have control over all this.
Yeah,
it's all
I own,
umbrella.
And so full disclosure on that end, obviously there's also an incentive for people to come to me. But I think, again, and you could believe what I say or you can not believe it. You don't have to. But there have been many, many people in my office that when I recommend a service and they say, well, I'm already going to such and such a place, that's fine. My biggest thing is, as long as there's no red flags, with the other places that you're going, and you're getting the care that is the care that you need, which there's a lot of reputable places out there, I have no problem. The whole point here is that you go somewhere that you get the right care. Look, this type of rehabilitation service should not be about who gives you the biggest discount or who does this for your insurance and this fraudulent thing and this fraudulent thing. That's not what this is about. What this is about is where can you get proper care. Yes, some things in our clinic, some services have a cost, but they're the way that cost works is it's all dependent on what is covered and what's not covered. So, physiotherapy is not covered by OHIP unless in some small instances after certain types of surgery in small instances. But in general, it's not covered by OHIP. So there's a fee for it if you have extended healthcare coverage. We do our very best, again, to try to make this as stress-free as possible. And we do bill directly to insurance companies. What people need to understand, though, is that stipulation is not mandated by us. It's if the insurance company will let your insurance be billed directly.
Right.
If it will, which most do now, we will bill directly. We will make it as easy as possible for the patient. But in some cases, certain plans stipulate that there's no direct billing.
So you got to reimburse them.
Yeah, so you got to reimburse them. So you might have to pay up front, but then you submit it. You might be reimbursed. And again, different stipulations. Some are reimbursed within 24 hours. Some might be a few days. I don't know. That's all, your insurance provider, which our team does help out. If you don't know what questions to ask, we can help call the insurance with you. That's an important thing with you. Find out what you may want to ask them and the specific questions. But again, the services are vast, and they're vast for that very reason, that we provide the best care. And other things that are covered by OHIP are covered by OHIP. If you see one of our surgeons, that is covered by OHIP.
It's funny you mention that, because every time I go through this with some sort of service that requires payment, whether it's dentist or otherwise, I go through my wife's benefits too, and I have my own, or I did have my own benefits, and then they're like, well, you got to submit through yours first. I'm like, well, it's my wife's plan. Yeah, but your birthday comes sooner in the year.
Yes.
So they're going to end up double backing and doing mine second, but I got to, you know what I mean? It's a pain in the ass, but you got to go through it.
And there's all weird things around insurance companies if you've got two different plans. Again, I'm not the best person to comment on that stuff. I don't know the insurance industry well enough that I can give you all of the answers. What I can tell you is it's just important to find out what you're entitled to. You're often given some type of booklet, or it's available online, and it's all pretty easy to find what those stipulations. But the other thing that's sort of a pet peeve of mine is if I recommend to somebody that they need, for example, chiropractic therapy, right? And they say, okay, well, I have $500 of coverage from my insurance. Is that enough? I don't know, number one. It depends on how you're progressing through it. But I don't think your health should be dictated just on how much coverage you have. Now, granted, we're not talking about things becoming expensive in the tens of thousands or thousands of dollars.
Right.
It might be a few $100 more. But I think if you're unwilling to invest in your health, then there's only so much we can help you, right? And, there are clinics, unfortunately, out there that will work, maybe provide free treatment outside of that. But I think this all goes hand in hand, that when there's an incentive for the professional, which is financial reward, they tend to want to do a better job. There's a reason why a lot of these types of services have been delisted. It's also because of the quality of care. Like, as an example, the physiotherapy that's covered after surgery sometimes. I've heard of places that will have like 13 people at one time, and they're just putting ice on their knees after knee surgeries. And then once that's done, they're leaving. Like, you could put ice on your own knee. You don't have to.
No kidding.
Right? But, when we're talking about the therapy that you get at our clinics, it is, the average session with a chiropractor or a physiotherapist might take 20, 30, potentially 40 minutes. And we're not just talking one thing. We're talking about the use of different types of modalities, different tools like maybe acupuncture, manual therapy to the issues, exercise rehabilitation, counseling to make sure you understand what's going on, showing you things you should be doing at home. It's extensive. This isn't just a 2-minute come in,
Captain Crunch, and away you go,
or whatever, or just a machine on your back and see you later. No, this is good treatment that you're getting, and it's the right type of treatment for the right type of injuries.
And again, it's PinPoint Health now, so you've got for lack of a better term, control over all the clinics, and it's going to be consistent right across the board.
Yeah, and our clinics are growing. We currently have 5 locations. We have 2 Etobicoke locations, a Brampton West location, Richmond Hill, and Newmarket, but we're continuing to grow. I'm working with, what I really try to do in this is acquire clinics that are existent, that are already providing great care, and grow it. So we'll be soon in Oakville, Markham, the Toronto area, and continue to grow. Now, we also have our provider network. So if you're outside of those areas that I just said, and you're thinking, well, maybe I shouldn't see Dr. Lou. Well, you still can see me, because if you need to see somebody, I still do have people all across Southern Ontario that can help you. And as this grows, I will just continue to expand into those areas. But definitely for the people that are more local, getting out to one of our clinics, and, people will say, oh, but that might be 10 or 15 minutes away from where I am, it might very well be worth it. I just encourage you, go try. It's worth traveling a little bit longer if you know you're going to get the right type of care. And I think the accountability that comes with this show and what we do is very important in terms of quality control.
PinPointHealth.ca is where you go. 1-855-55 Lou, DRLOU. It's also PinPoint Health on social as well. It's a PinPoint Health Show on Global News Radio. The PinPoint Health Show. Yeah, you want to reach out, get a hold of Dr. Lou. It is info@pinpointhealth.ca. Also PinPoint Health on social when it comes to Facebook and Instagram. In that regard, check it out. All kinds of really helpful stuff, snippets from the radio show right here, and videos up on Instagram especially, and Facebook that you can follow. And, man, you can sure educate yourself a whole lot better. When it comes to what we talk about here on the show, 1-855-55 Dr. Lou, DRLOU. We mentioned a couple segments back about the PRP. I want to talk more about the actual services you provide through the network.
Sure, yeah.
Okay.
So, I mean, we could start, again, rehabilitation services in general. So we've got things like registered massage therapy, which is very important, right? This is a big thing too, where people think that a masseuse and a registered massage therapist are the same thing. It's not even close to the same thing. We offer regulated healthcare professions, which means regulated means it protects you, the public. That's a very important aspect.
Okay.
That means there's a regulatory body that takes complaints from the public if something is breached in that interaction between the person and the healthcare professional. So registered massage therapy is a regulated profession, and it's very important. And their education is expansive as well. And they have great education. Then we have things like physiotherapy, chiropractic therapy, naturopathic medicine. We also have osteopathy, which is not a regulated profession, but we make sure we get the right types of individuals and they work alongside the other professionals. We also offer things like injections, like the PRP injection. Our surgeons will sometimes, in certain cases, also potentially do cortisone injections and other different types of injections. There's medical consultations with professionals like orthopedic surgeons or physiatrists. Again, everything's sort of tailored towards injury and pain management. There's also the active component. So we actually have trainers that can also train you. We actually have people that actually will go in-home training. So people that once you get to a point where you're doing so well and you just need the upkeep, we can send someone to your home to train you. Occupational therapists that can come into your house or to your work area and sort of start to modify from a more ergonomic perspective, in terms of what might be better in terms of you setting up your workstation or your home life in a way that is more ergonomically correct and can minimize repetitive strain and sprain and things like that. So, and I may even be missing some as I'm thinking here. But again, I encourage everybody, pinpointhealth.ca. It's all there on the website. We've not only to mention our hours, for example, we are open late a lot of evenings, early a lot of mornings. We're open on weekends, Saturdays and Sundays, which is great for care, right? People have busy lives. And one of the biggest hindrance towards care is commitment to that care.
Right.
And if you've got a place that's only open, 10 to 4, well, that provides a little bit of a limited access for people when they're working, when people have, like you and I probably couldn't go in between those times. But if you're open as early as 7 and as late as 9 o'clock, 10 o'clock in some instances, Saturdays, Sundays, providing weekend availability for all these different types of services, it makes a great difference towards patient commitment towards their care. And we try to, and that's why we do what we do in terms of that sense of the hours of operation. And so, yeah, that's I guess a synopsis of a lot of those lists. And I mean, if you're interested to find out more, you can also always call me, 1-855-55 Dr. Lou, DRLOU, or send me an email at info@pinpointhealth.ca.
There's two of those things. You listed all those services you provide. Two, I think you want to earmark for more discussion. The first one was naturopath.
Yep.
Sometimes, and you know this as well, between the naturopath world and the physio world, or general doctors and practitioners, they've been at loggerheads for some time because quite often they're conflicted with both of them believe. I think it's really cool that you embrace that side of it as part of your care.
So the big thing with us is I stress this very much, is integrative care.
Right.
Okay. I'm a big believer that we have a lot of different tools at our disposal. And in my life in general, I'm a believer of moderation and that everything has its place. Okay. And that's why I don't discount any therapies. My biggest pet peeve is when you think one thing, or not you specifically, but when someone thinks one thing is the answer to everything. And I don't care whether that's on the more alternative end or even more so on the more conventional Western medicine, because you gave there's people that are more alternative-based medicine that will completely negate everything that Western medicine says and tell their patients that they shouldn't be taking their medication.
Don't do this, or
don't vaccinate, all these things.
Stuff.
And I disagree with that. But I equally disagree with people on the Western side that are completely medical and say, well, there's no benefit to doing all these other things. You shouldn't do massage. You shouldn't do physio. It doesn't help at all. No, it's wrong. I think we have a lot of tools if we can use it in an integrative approach, which is a big thing at PinPoint Health. If you can use that integrative medicine, then you are more likely to do well. Like, what's wrong with using everything that we're so lucky in the time that we live to have all of these things. I remember once someone saying that, the example of Western medicine being like a fire truck. You wouldn't necessarily, if you have a fire going on in your house, you're definitely going to call a fire truck, but you're not going to prevent a fire by calling the fire department every day and having them water it down, right? You would do other things in your house.
Right.
And so that's the combination. How do you prevent fires? It's a combination of prevention with the low-level interventions that you can do. But in the event that something does happen that is more extreme, you have those emergency services. And that's why when we talk about this, and I talk about moving always from conservative measures to more invasive measures, we have those tools. Although we have surgeons, that doesn't mean that everybody that's walking through the door we're pushing surgery on them. No, if we can avoid that, we will. But in some instances, when you have that fire going on and you need a fire truck, well, what's wrong with having it there?
Right.
And I encourage people to be open to those things, because that's really quality of care. And I've seen examples of people that will say they didn't want to take a certain medication, for example. I can actually remember one case of a person who had a very severe autoimmune disease. And early on in this autoimmune disease, they were recommended to take specific medication towards that autoimmune disease that would have stopped the inflammation or at least controlled a lot of it. And they basically said, no, there's too many risks to that medication. We don't want to take it. But I'm seeing them 20 years later, and the amount of destruction that has happened to their body because of the inflammation. I said to them, if you could go back now, would you have taken that medication?
Right.
And they said yes, because, and again, that's what we've always talked about, is the realm of possibilities that you don't know.
Right.
You don't know what it could be like. But I encourage people, consider that realm of possibilities that you don't know yet. Because when you consider that, you're not making a decision based on today, right now. You're making a decision over your life.
Yeah.
And that's and I mean, that goes with anything. There's shows on this station about investing in your future from a financial perspective. No different. Like, you sometimes have to remove just the instant gratification from a decision and think about, well, how does this play over the extent of my life? Right? Sure, there might be negatives, and that's really what healthcare is. It's everything has a health benefit and a potential risk. It's about weighing those two options and coming up with the best decision that you don't have to do that on your own. You do it with your healthcare team.
1-855-55 Dr. Lou, DRLOU, info at pinpointhealth.ca. We'll get to lots more right here on the PinPoint Health Show on Global News Radio. You want to reach out anytime, get a hold of Dr. Lou here in the PinPoint Health Show. You can go to pinpointhealth.ca, info at pinpointhealth.ca through email. On social media as well, like Instagram and Facebook, just search PinPoint Health and 1-855-55 Dr. Lou, DRLOU. We were talking about some of the specific services you guys offer and the benefits of having a well-rounded clinic or clinics that offer a wide array of stuff, which people should really have as many arrows in their quill as they possibly can when they're attacking a problem. And one thing I always thought from years ago when you used to bring Dr. Gordon and Dr. Bergava on the show, these guys are high-level surgeons, and I've any physio I've had with the history of my back, I don't know a lot of clinics that have that type of outreach and have that type of service available to have surgeons right there in the office with you.
Yeah, and that's a big, again, going to, what is the distinguishing feature of PinPoint Health?
Right.
And I really think that's a big distinguishing feature is we're really, one thing that I've tried to do is look at the system in general. We were talking about how there's a systemic problem in healthcare, unfortunately. And I've looked at that and said, well, at the very least in our world, in PinPoint Health's world, how can we make that so much easier for patients? And that's what we've tried to do. Like even things like seeing me, you're not going to have to wait months to see me.
Right.
I specifically have tailored my schedule so that I'm only doing new patient assessments. It's not because I don't love to treat. It's because I know that if I can have my team treat, I have more time to do assessments. We can get people in sooner, not to mention, like you said, then having the network of people that we have. If we believe someone needs to see a surgeon, for example, like Dr. Gordon or Dr. Brigava, we can expedite that. We don't have to worry about back to the family doctor. And the biggest thing here is because we have relationships, right? A lot of times when family doctors are making referral, it's just a name on a screen, right? And then it goes to that doctor, and that doctor is equally, it's just coming from another name on a screen, right? That the relationship aspect is so important. And I've really tried to sit there and say, okay, how do we really make this a multidisciplinary clinic with the extent of services that anybody suffering with a pain or injury problem would require? Now, not all of our locations will have a surgeon in them, for example. But if you're in one of our clinics, you're now within our system. We can get you in to see someone very, very quickly, right? So services may vary from location to location, but that's purposeful because that way we can really build different specialties in different places. And that way that's what's available to everybody.
You know, I brought up Brigava and Dr. Gordon for a specific reason, and we've done shows on this in the past. We've had them on the air, and they're funny. They're great guys to talk to on the air as well.
Us,
and they're still with you, of course.
Yep.
And, you know, we often talk about, I guess, worldwide, especially not just in North America, but Japan as well, where everyone's heralded to be, you know, living to 170, and they're all in fantastic health. It's an aging population.
Yes.
And the knee replacement and knee therapy is massive. And PRP is a good stop before you got to get under the knife, as they say, right?
And outside of just thinking about the knee, as we live longer, we will break down more. That's just the reality of it. We will succumb to more mechanical issues like knee issues, knee osteoarthritis, hip osteoarthritis, the longer we live. That's why these things are so much more prevalent right now. That's why you're hearing about it. So it's not that arthritis didn't exist once upon a time, but when people were living a shorter life, there was less time for wear and tear to set in and affect. And I always say these are things that, you know, the world that we're in with pain and injury is not, it's not as, you know, we're not dealing with quantity of life. Right? Nobody has an ache in their arm and it's going to kill them tomorrow. We're dealing with quality of life. And that's where we can make a big difference. So the quantity of our lives, as you said, is getting very much longer as we progress and we become more advanced. But we also want to make sure, and what we're trying to do at PinPoint Health is make sure that as that happens, your quality of life stays the same. Because, I mean, what's quantity without some type of quality? Mm-hmm. Yep. Right? And I mean, we can't promise that we'll keep the same quality of life that you had when you were 20 years old. But we can definitely, and a lot of times when I see people and I'm recommending therapy, they'll say, is this going to make me better? And I'll educate them. I'll say, well, it's not so much about making you better because you're not that bad. What it might be more important is delaying this so that as you continue to get older, it doesn't get any worse. Because right now you're at a state that it's manageable. But what happens in 5 years, 10 years? Do you want it to progress to the point where it becomes an absolute disability, where it actually affects your ability to function? And if the answer to that is no, then a lot of times these different interventions and therapies are really also about maintenance of where your current state is.
Right. Because it's amazing. I just think of, you know, my own mom who's, you know, in her mid 80s now, and back, I remember when, you know, your grandmother before that was 80. She was a little old lady in a rocking chair with a blanket.
Not
people in their 70s or 80s are not like that. They're running marathons, man. They've got to make that body last.
Yeah, the world is very much changing. And again, we like modern medicine, again, has done an incredible job of keeping us alive longer because we're able to identify things sooner. There's great procedures out there that when something does happen, again, the analogy of that fire truck, we have an amazing medical system that provides that amazing fire response right away when it's required. And that saves people's lives. I think a lot of times, too, when people go through these types of things, when their life is saved, they potentially also change and become healthier because it's sort of like you have that second chance.
Yeah.
And so, again, all of that equates to just living longer. But what hasn't changed is our bodies will still deteriorate.
Yep.
That's genetic. That's evolutionary. That's just the way our bodies are. That's why things like spinal stenosis in the lumbar spine is so much more prevalent as you get older. Hip osteoarthritis, knee osteoarthritis, pretty much arthritis throughout the spine. And not even that, but tendons start to fray. Muscles start to become weaker. As all that happens, it creates a syndrome of problems and pain that people will experience. And really, in that point, it might also just be about not necessarily going back because we don't have enough tech. You know, you can go back in some extent, like with a knee replacement, But sometimes if you're not that bad, if it's manageable, and we can get it to a point where it's manageable and not affecting you day to day, a lot of our success comes in preventing it from getting worse.
Right. 1-855-55-Dr. DRLOU to reach out by phone, info@paincarecanada.ca. Pardon me, pinpointhealth.ca. I'm still in the old one. And social media as well.
That still exists. If they go there, they'll just be redirected.
You don't want to
just
get redirected. Social, as far as Instagram and Facebook as well, just search Pinpoint Health. You'll see all kinds of really amazing information, videos, and audio from this radio show, and really a lot of helpful videos are done by a lot of the practitioners in your clinic. So check that out. We're going to take a short break and get into a few more minutes here of the Pinpoint Health Show on Global News Radio. Pinpoint Health Show, really simple to reach out now across the board, pinpointhealth.ca. That goes for the email as well, which is simply info@pinpointhealth.ca. On social, you search that as well. Look for videos, a lot of information in that regard. And the phone number, 1-855-55-Dr. Lou, DRLOU. We spent a lot of time talking about, people that are getting to the age where there's aches and pains and they've got to have some health management through your clinics. But this is also a big topic with the young. They're athletic, they're active, they're doing things maybe they shouldn't be doing, but you're taking care of them as well, right?
Sure. So I think maybe we've, in this last show, it sounds like we're dealing more with just the aging population and things that are a result of deterioration and degeneration. But that's not it. We also have high-functioning performance athletes that come to our clinics. We have young people who are that just are looking for optimal function. So there's a lot of people that overall don't have a problem, but they're looking, how do we optimize their function in terms of, it might be related to sport, and it usually is. And that is a big component of what we do. We deal with a lot of injuries that happen as a result of sports issues. So whether it's something like a concussion, all the way to a meniscus tear, an ACL tear in a soccer player, we're dealing with the extent of people. So Pinpoint Health is for everybody, whether you're the average person, an elite athlete, you're getting older. We're really here if you have any type of pain or injury issue that's going on. We may potentially be the right place for you to give us a call. You can call 1-855-55-Dr. Lou, DRLOU. That'll take you into the Pinpoint Health Network. If you want to have an assessment with me, I'm happy to do that. And let's spend a little bit of time talking about that. Obviously, a lot of people from the show want to see me, and that's what I do. I will see people that want to have my assessment. Starts with a free consultation where you call in. We sort of identify, are you a good candidate for my assessment? Then you come in and we go through, usually takes about an hour and a half of full history, physical exam, potentially other testing, potentially getting other professionals involved. And come to some type of a diagnosis or a plan of diagnosis, and then include a plan of management. So what is it that you're going to do to get better? And that's always a combination. We are very big on passive care, which is the things that our team can do to you, the patient, but we are equally as big on active care, which is what will you need to be doing for yourself to get better. And if those two aren't working in harmony, then I can tell you that your chance of getting well is not good. And I've always said you can come in every day for 2 hours every day. If you're not doing stuff the right way for the next 22 hours at home, at work, then unfortunately you're sort of going to be stuck with what you have. It goes both ways.
It's amazing. And whenever you mention on the show, I always go back to my sister-in-law, who was never a pro athlete, average, mid-50s now, average activity level. Had a real wake-up call last year with her lower back, as you know, and it was like it got into her head. She had some other problems that went along with it that stem from this. Yeah. Went to see you guys. She got a plan of management, and every month or two, I'll say, Cam, you do? Yep, every night. Does the exercises every night, man, and it has been a 180.
Yeah,
and she's doing it.
We've had people call in, and I remember a few weeks ago there was someone that called in and basically said that, I think, and I'm not trying to just big myself up, but she said we saved her life because we gave her the right type of care, and she's followed through. And the funny part is she's not even coming to our clinic. She's seen one of our trusted providers. She only saw me once, but credits me with helping to save her life because of the things that she was going through. When your quality of life is affected that bad, it is like saving your life, right? Mm-hmm. Like sure. I'm not stopping people's heart attacks and things like that. But when someone's quality is so poor due to the things that they're feeling in their body, if you can change that, hey, that's everything. If you can live your life and enjoy it, that's the most important thing.
And we haven't even spoken about the mental component of all this.
That's a whole other thing.
That's a whole other thing on the show, right? But
and we'll speak about that. every week. Tune in 11 o'clock.
Yep.
Every Saturday, we're here to provide this. But feel free to call 1-855-55 Dr. Lou, DRLOU, to have that conversation with me anyways if you're thinking of asking questions, or send an email, info@pinpointhealth.ca.
It's amazing, though, before we wrap, and some people are thinking, you just mentioned that you deal with a lot of sports and sports athletes, and people are thinking, well, I'm not an athlete. Of course, I'm not in type of physical condition. But the thing with athletes and this can trickle down to the oldest person who comes to see you, is the one thing athletes do is when you tell them to do something, if there's that part of their health, they do it, and they're absolutely diligent because they want to get back out there and do their sport. That goes for everybody.
I get a lot of people calling saying, thank you.
Right.
Your team, you guys helped me get better. And I will often say, thank yourself, because I know what our plan of management includes with these types of things, and always it includes an active component. And if you didn't do it yourself, you wouldn't have gotten better. So anybody that credits just us to getting better, I think I definitely credit my team. But I think it's just as important to credit yourself and doing what you should be doing, because if you don't do that part, then again you're setting yourself up for failure. And I think that's the right type of person. If you want to get better, then give us a call. And PinPoint Health, again, the rebrand is very important. We focus on rehab, therapy, and wellness, and those three things are not by accident. Rehabilitation is the process of optimizing function or finding function. Therapy is the interventions that we would use to do those things. And once that's working in harmony, you start to move towards wellness. And that's an important thing.
So good stuff this week, brother. We'll leave it at that. And you want to reach out, get a hold of Dr. Lou. Really, really simple. 1-855-55 Dr. Lou, DRLOU. PinPointHealth.ca online. That goes for social as well. You'll want to spend some time on his Facebook and Instagram as well, as far as PinPoint Health is concerned. And info@PinPointHealth.ca to reach out through email. We'll do it all again next week right here on the PinPoint Health Show on Global News Radio.